Is a cystoscopy necessary for bladder diagnosis? Have you ever wondered if a cystoscopy is really needed to diagnose bladder issues? Let's explore this important medical procedure. Cystoscopy is a method used to look inside the bladder and urethra. It involves a thin tube called a cystoscope that has a camera and light. This tool is inserted through the urethra into the bladder, allowing doctors to see any problems directly. So, when is cystoscopy necessary? One major reason is for diagnosing bladder cancer. This procedure is vital because it lets doctors see the bladder lining for any tumors. If they find something suspicious, they can take a biopsy right then and there. Early detection of bladder cancer is crucial for effective treatment. Another situation where cystoscopy is often used is for interstitial cystitis or bladder pain syndrome. This condition can be tricky to diagnose, but cystoscopy helps by revealing specific changes in the bladder, such as Hunner's ulcers. Cystoscopy can also be very helpful for patients who have ongoing urinary symptoms. If someone has blood in their urine, frequent urination, or pain, cystoscopy can help identify the cause. It can reveal issues like stones or other abnormalities that might be causing these symptoms. Additionally, cystoscopy is used for monitoring known bladder conditions. If someone has already been diagnosed with a bladder issue, this procedure can help track any changes over time. It's a way to ensure that the condition isn't getting worse or to check for any recurrence, especially in cases of bladder cancer. What about the benefits and risks? The main benefit of cystoscopy is that it provides a clear view of the bladder, which leads to accurate diagnosis and sometimes treatment during the same visit. It is generally safe and can often be done with local anesthesia. However, like any medical procedure, there are some risks. Patients may experience temporary discomfort, minor bleeding, or urinary tract infections. Serious complications are rare but can happen. While cystoscopy is a key diagnostic tool, it's not the only option. Other tests like ultrasound, CORT scans, and urinalysis can be used first to assess bladder health. However, these tests do not offer the same detailed view as cystoscopy. In summary, cystoscopy is a necessary procedure for diagnosing bladder conditions, especially when symptoms suggest serious issues like bladder cancer. It's important to consult with a healthcare professional who can determine if this procedure is right for you based on your specific situation.